Many of us have at least a little excess weight and bulges in places we don't want them. Common problem spots are in the stomach, legs, upper arms, waist, hips, and chin. Often, no matter how much you diet and exercise, you can't seem to lose the excess fat in these areas. Liposuction permanently gets rid of it. Tumescent liposuction is a permanent and safe procedure in which liquid is injected into the area being treated and then extracted out along with the excess fat cells. This form of liposuction allows doctors to do more precise work on smaller areas of the body. The physicians at the Center for Cosmetic Enhancement typically perform liposuction in their own surgical units. Patients receive local or general anesthesia and suffer no pain or discomfort during the procedure. Afterwards, the patient may have some soreness, swelling, and bruising. Most of these side effects only last for 5 to 10 days. Within 4 to 8 weeks, patients will see the full results. Because the fat cells are removed, most patients do not regain weight in the treated areas.
So how did you find the procedure?
It was a lot better than I expected. It was no pain.
No discomfort?
Not really, no.
Okay, so I'm sure we'll have some great results. And
yeah, I'm looking forward to that.
We'll see you soon.
Okay, thank you.
In addition to cosmetic procedures, the physicians at Skin and Cancer Associates treat all dermatologic problems, including the most dangerous skin condition, skin cancer.
In the 60s, magazine editor Diana Vreeland came back from the Mediterranean with a suntan, and it became vogue. Decades later, we're still paying the price for fashion's folly. Hello, I'm Kathleen Sullivan, and this is Today's Health. The sun produces invisible rays known as ultraviolet or UV light. These rays cause skin damage, and it's now very clear that the perfect tan is no tan at all. The incidence of skin cancer has reached epidemic proportions, and the most deadly type, malignant melanoma, has doubled among Caucasians within the last 20 years. Fortunately, early detection and treatment are starting to reduce the yearly toll.
I believe I developed skin cancer from living in South Florida for 50 years and spending a lot of time when I was younger at the beach, water skiing. And I worked construction work in my teenage years, so I was constantly in the sun. I come in every 4 to 6 weeks here, and every time he will either freeze something off or cut it out and cauterize it, or it would be a plastic surgeon would have to take care of it.
This year, over 80,000 people will discover that they have the most deadly form of skin cancer there is, malignant melanoma. If caught early, melanoma can be treated successfully, but unfortunately, this type of skin cancer will probably account for over 7,000 deaths.
Melanoma is the worst of the 3 skin cancers in terms of these individuals have a higher chance of dying from their cancer. Melanomas, when caught early, have a 99% cure rate. Approximately 10 to 15% of melanomas arise out of a pre-existing mole. The rest arise out of brown discolored areas of skin. Melanomas can spread 2 ways, one by the lymphatic system and one by way of the bloodstream. So the best treatment for melanoma is an early recognition.
Carcinomas appear almost exclusively in light-skinned people. Melanomas appear more frequently in Caucasians, but they can also develop on dark brown or black skin.
Young people that go to the beach sit all day for the suntan without sunblock. It's going to lead to skin cancer, plus aging of the skin. They're going to get wrinkles faster.
The current epidemic of skin cancer can be due in large part to our years as a nation of unprotected sun worshippers. Now we know better, but the damage may have already been done. Your vigilance and periodic self-examination can help spot an early skin cancer before it becomes untreatable.
The ozone layer can no longer shield us as well from the sun's UV rays. The EPA estimates that ozone depletion over the United States will lead to an additional 200,000 skin cancer deaths during the next 50 years.
Have you ever seen more perfect skin? Soft, supple, unblemished, and untainted by the sun. The sun is murder on your skin and could be deadly to you too. Consider this. By the year 2000, your risk for developing a malignant melanoma will be 1 in 75, compared to 1 in 1,500 in the 1930s, when tans weren't considered fashionable. Now, this statistic tells us one thing loud and clear: limit your time in the sun. Obviously, we can't all hide indoors and become a nation of night people, but there are several precautions specified by the American Academy of Dermatology that can help us minimize our sun exposure and the risk of skin cancer and premature aging that comes with it.
People can limit their exposure to the sun by slipping on a hat, slopping on some sunscreen, and placing a shirt on when they go outside. They can also try to go out in the sun early in the morning or late in the day. Children should be protected from the sun. We know that it's the cumulative sun exposure over many years which causes problems later in life. When using sunscreens, one should use a sunscreen with a sun protection factor of 15. Sunscreen should be applied approximately 45 minutes to an hour prior to going out in the sun.
If you think it's too much trouble to shield yourself from the sun, maybe this statistic will change your mind. The sun causes 90% of all skin cancer and 90% of all wrinkles.
The reason I think I developed melanoma is because as a child, I was in the sun all the time. I'm very fair-skinned. All my friends, my family, we always spent vacations in the sun, and I eventually moved to Miami Beach. I sat in the sun without any sunscreen. In those days, nobody used sunscreen, and we would use iodine and baby oil, spread it all over us, and sit with sun reflectors to get more sun. And if the sun wasn't out one day, we would even sit under sun lamps. Everyone I knew would get beautiful color bronze, and I would get freckles and turn red, and it was not a pretty sight. I presume those early days were the beginning of my getting a melanoma.
Self-examination certainly plays a role in diagnosing early skin cancer. We are at our best in knowing our own bodies, and therefore, if something changes, color or crust or scales, these are some of the early warning signs that one might be developing a skin cancer.
By taking the proper precautions, we can prevent further damage. And by practicing regular self-examinations, we can spot dangerous growths before they become deadly skin cancers. We're a lot older now, and hopefully a little wiser. And with that, abandon our fascination with getting a tan, because it's clearly a case of indecent exposure.
The best cure for skin cancer is prevention. Skin and Cancer Associates recommends that everyone wear at least a 30 SPF sunblock every time they're out in the sun. And remember, early detection is key to your treatment. Everyone should regularly check their skin for irregularities, especially on the face, arms, legs, shoulders, and back.
Now, live from the 7 Health Center, here's HealthCast with Marilyn Mitchell.
Lasers, chemical peels, glycolic acid washes, these are just some of the things people are having done today to try and turn back the hands of time, or at least prevent them from moving forward. But these techniques may be doing more than just saving face. They may actually help prevent cancer.
Wrinkles, they're no laughing matter.
It stops the aging process dead in its tracks.
Let's face it, most of us are looking for the fountain of youth. Some seem to have found it. What's their secret?
You're incredible.
Actually, it's not a secret. It's a little nip here and a little tuck there. In other words, cosmetic surgery. In today's space age, lasers are among the most popular devices in fighting the war against aging.
You can kind of see the wrinkles melting away.
Another popular technique to battle wrinkles, chemical peels. There are also glycolic acid washes. And what about all those over-the-counter lotions containing glycolic acid that we're slathering all over our bodies? Yes, all of these things can help slough off skin and slow down the aging process and even reverse it. But there may be a much greater benefit: preventing skin cancer.
It actually gets rid and prevents skin cancers from occurring. It can get rid of wrinkles, lines, and aging.
Some dermatologists believe by removing the top layer of skin, you also wipe out any precancerous and cancerous cells, leaving behind healthy skin.